This is a very big question to answer in 5 minutes. I think it's helpful to think of the anatomy of the man when trying to ascertain the possible causes of male infertility. So if you imagine you've got a testis and you've got tubes. So the sperm is created in the testes and has to come out via these quite long tubes to make an ejaculate sample. So one cause of male infertility would be that the tubes are blocked somewhere along the line. Sometimes that can occur naturally, but sometimes it's been created by surgery, such as a vasectomy. So sometimes we'd have infertility and maybe a man has had a vasectomy because he's already had a family and didn't want any more, and now he has a new partner, but he's not producing any sperm because the tube has been cut. But then again, maybe the tubes are fine, but the man in the testes is not actually making any normal sperm. And this means that his ejaculate sample will contain water and salt, but won't contain any sperm. And then sometimes the tubes are fine, and so the tubes are open and the testes are producing sperm, but a man may have been exposed to some toxic chemicals like smoking or heavy metals, air pollution. And this can reduce the quality and quantity of sperm that a man can produce. So how do you work out what the cause is? As with everything in medicine, the history is really important. And so in the history, sometimes when you speak to the patient, that can help you. It will indicate what might be wrong. So for example, if a patient explains that his testes didn't descend properly when he was a child, or he had operations on the testes or hernia repairs, then we might be starting to think that there's a structural problem with the testes, and that might be related to a problem with sperm production on a genetic level. However, if a man has a job that exposes him to chemicals, so he might work in the printing industry or the petrochemical industry, then that might be the cause. How do we know if a man's sperm might be the cause of the infertility that a couple are sharing? Often when you speak to a couple that might have a male fertility factor, you'll often find out that they have a really long history of infertility and they've had maybe multiple miscarriages, but the woman herself is still young. She still seems to have quite a good ovarian reserve and nothing has been found to be wrong with her uterus. And that's when the alarm bells start to ring that there may be a male contributing factor. Often, of course, the sperm test, the seminogram, will be the starting point for the investigations, but you can do a blood test to look at the chromosomes, and genetic tests in ejaculate samples, such as the DNA fragmentation test or the FISH test, can be done.